Today, we're looking into a really quite inspiring story about resilience, about mindset when you're facing, well, major health challenges.
Yeah, it's based on an interview you shared with Sue Nordemo. She's got this incredible background, nurse for decades, hypnotherapist, Reiki master, and she recently went through cancer.
Exactly. And our goal here is really to unpack her journey, see what we can learn, what insights pop out.
Definitely. And her nursing background, starting way back in 65, gives her such a unique perspective on getting that diagnosis in 2023.
Right. The interview actually starts with a nice moment, a sort of chance meeting with another hypnotherapist, Lisa Schermerhorn.
It does, yeah. It really sets the scene for the kind of supportive community around Sue. And then pretty quickly, we get to the moment she found the tumor.
And it was quite sudden, wasn't it? She describes noticing a small, itchy spot, maybe a spider bite, she thought.
Yeah, initially. But then within days, it became clear it was a significant tumor growing incredibly fast.
What's really striking, though, and something for listeners to maybe think about, is her immediate reaction.
Right. Despite the shock, she talks about just acceptance and this really proactive approach.
That nursing experience must have played a huge part. She wasn't focused on fear.
Not at all.
Hmm.
She actually emphasizes that the absence of fear through the whole thing.
Yeah.
She puts it down to her attitude. Years of, well, what she now sees were holistic practices, even if she didn't label them that way back then.
It's fascinating, that link between her professional self and her patient self.
Totally. Like, instead of being scared about the diagnosis, her first question to the surgeon was basically, okay, when do we start?
That focus on action, on solutions, it's powerful, not getting bogged down in the what-ifs.
Exactly. And things moved incredibly fast from there.
Yeah, she talks about getting into the medical system almost immediately, biopsies done right there in the office.
And starting chemo just days later. It was really rapid.
And another key thing that stands out is the community support she had.
Oh, absolutely. She mentions her neighbor, who happens to be a nurse living right across the street.
And she just immediately stepped up, offered to help with wound care, that kind of collaboration.
It's a perfect example, isn't it? Combining that professional know-how with real personal support. It shows she wasn't just passively receiving treatment. She was an active participant with skilled help right there.
Okay, so she starts chemo, and then comes this really remarkable part about her response.
Yeah, this is pretty amazing. After only the first week of chemotherapy.
Just 1 week.
Right. Her oncologist was apparently astonished. The tumor was already shrinking, and shrinking rapidly.
And the doctor said she'd never seen such a quick response in all her years.
That's what Sue recounts. And interestingly, the oncologist herself suggested it might be linked to Sue's positive attitude.
Wow. That really brings it home, doesn't it? The potential power of your mindset working alongside the medical treatment.
It really does. Obviously, the chemo was doing its job, but that observation from the doctor, it suggests this really strong interplay between her mental state and the physical effects.
It makes you wonder, how much can our internal state influence the healing process?
It's a huge question. And Sue herself points to what she calls her core pillars.
Right. Humor, resilience, and spirituality.
Yeah, she felt these traits were always there, but they really got amplified after the diagnosis.
Yeah.
And they were crucial for her.
And her use of language is fascinating, too. How she deliberately chose her words.
Oh, definitely. Always calling it the cancer, lowercase c, never my cancer.
Creating that distance.
Exactly. And insisting she was healed, not a survivor.
Which isn't just playing with words, is it? It's a mental strategy. It's framing her reality.
Completely. It's a proactive belief in her recovery, framing it as a completed process of victory rather than an ongoing battle. It shows how powerful the words we choose can be.
And that positive framing carried over into how she viewed the chemo itself.
Right. She made a conscious choice not to fixate on all the potential negative side effects everyone warns you about.
She even talked to her chemo nurse about it, didn't she? Suggested reframing that whole side effect conversation for patients.
Yeah. Encouraging them to see their active role in healing, emphasizing the positive attitude aspect. It's quite something, turning her own approach into advocacy for others.
And her humor about losing her hair, even her facial hair disappearing, seeing it as a bonus.
I know. It's such a great example of finding the funny side, reframing something difficult. That's real resilience in action.
So, alongside the conventional medicine, she was actively using other things too, complementary practices.
Yes, quite a few. She mentions this special drink she made, vitamin C and tart cherry juice.
which she found really helped with joint pain and just feeling better overall.
Apparently so, yeah. Even though, interestingly, a nutritionist was apparently a bit skeptical about it.
But she stuck with what felt right for her.
Exactly. And she also used hypnosis quite a bit.
Right, which involves that focused relaxation to influence thoughts.
Yeah, and she had a personalized script made, which even included humor, tailoring it to her personality.
And there's that wave watch thing too, sound technology.
Uh-huh. It's a device that uses specific sound frequencies.
Hmm.
She used it to try and manage potential side effects. These were all part of her own self-care toolkit.
It shows that proactive approach again, doesn't it? Not just relying on one thing, but building her own support system.
Definitely. Seeking out tools she felt resonated with her and could help her heal, even if they were a bit outside the mainstream.
Now, her journey wasn't without unexpected setbacks. There was a pretty serious incident at home.
Yeah, that was quite alarming. She had a bad fall and was actually on the floor for almost 2 days before friends found her.
Gosh, that really highlights how vital a support network is, especially if you live alone.
Absolutely critical.
Mm-hmm.
And that fall led to a hospital stay, and then she was transferred to a rehab facility.
And the rehab place had a big COVID outbreak happening at the time.
Widespread, yeah. But remarkably, Sue navigated that whole situation without getting infected herself.
Which, again, could be testament to her resilience or maybe those supportive practices she was doing. It's hard to say for sure.
It is. But it's another piece of her rather extraordinary story.
And even through all that, the hospital, the rehab, her sense of humor was still there.
Constantly. She was joking with the paramedics about what year it was.
Right.
And connecting with staff and other patients in the rehab facility, apparently lifting their spirits too.
It's like her positivity was infectious, in a good way, a useful coping mechanism for sure.
Definitely. It not only helps the person themselves, but can really change the dynamic with caregivers, making the whole environment more supportive.
So after chemo, she decided on a double mastectomy.
Yeah, and her attitude seemed very decisive there, just wanting to deal with it directly.
And she talks about managing afterwards, the drains and things, again with her neighbor's help.
And she reported having minimal pain post-surgery.
Which she felt the wave watch and hypnosis contributed to.
That was her feeling, yes. And there's even a funny little story about a young assistant removing one of the drains.
Oh, yeah.
Just another moment where her humor kind of lightened a potentially awkward or uncomfortable situation.
It's a consistent theme, isn't it?
It really is, that ability to find lightness.
Now, Lisa, the interviewer, mentions a specific moment related to Sue's blood counts.
Ah, yes. Apparently her red blood cell count got critically low at one point.
Right. But then after what Lisa refers to as quantum healing, it returned to normal quite quickly.
It's definitely touching on that mind-body connection, maybe even energy work, which seems to be part of Sue's overall belief system.
It highlights how she embraced a really wide range of approaches, didn't she? Beyond just the conventional.
Absolutely.
Yeah.
It underscores that healing can be viewed from many angles, and belief itself can be a powerful factor.
So after surgery, there was radiation therapy.
Yes. And again, she used the wave watch during that time.
And she felt it helped prevent severe burns.
Remarkably so, according to her account. Very positive results. And now she's on immunotherapy, Keytruda.
Okay. But she's made a clear decision about further preventative drugs.
Very firm on that, yes. She's refused them because she fundamentally believes she is healed.
That's quite a stance. It speaks volumes about her conviction and her trust in her own body now.
It really does. A powerful sense of self-efficacy.
And perhaps the most profound thing, for me anyway, is how she frames the entire experience.
You mean calling it the best thing that ever happened to her?
Exactly. I mean, to reframe cancer like that, it's extraordinary.
It really is. She talks about how it deepened her spirituality, led to this major life review.
Right. Reinforcing her belief in making choices aligned with who she truly is.
And apparently, as part of that transformation, she just stopped drinking alcohol. Effortlessly.
Wow. It suggests the cancer acted as this huge catalyst for deep personal growth.
That seems to be exactly how she sees it. A difficult path, no doubt, but one that led to positive transformation.
And she talks more specifically about that spiritual side deepening.
She does. She mentions engaging with the prayer of Jabez, feeling this constant connection with God and Jesus.
And finding that incredibly supportive.
Profoundly so, it sounds like. For many people facing serious illness, that spiritual dimension becomes a vital source of strength and comfort.
Yeah, finding that deeper connection, that sense of purpose can be really grounding.
Definitely. And it all seems to circle back in a way, to that power of positive thinking she embodies.
And the language, the reframing.
Yes. How you talk about things, how you see them, shapes your reality. She even tells this amazing anecdote.
About the property tax bill.
Yeah. How she had this conversation with God about it, and then somehow the bill ended up being zeroed out.
It's a compelling story, however you interpret it. It really shows her unwavering belief in her connection and the power of her mindset.
It really illustrates her deep-seated faith in, well, in something bigger,
Hmm.
and in her thoughts influencing outcomes.
And she's not just keeping this experience to herself, is she? She's involved in helping others,
That's right. She's active in a breast cancer support group now.
sharing her experiences, talking about Reiki and hypnosis.
Yeah, demonstrating that desire to give back, to support others going through similar things is really inspiring.
It truly is. Paying it forward, using her journey to potentially help others find their own way.
So, Sue Nordemo's story, when you boil it down, it's just this incredible example of how mindset, integrating different practices, having strong support, how all that can really shape your experience of a major health crisis.
Yeah, that blend of humor, resilience, spirituality alongside the medical side. It created this holistic approach that just worked so well for her.
So thinking about her journey, what really stands out for you listening
Mm-hmm.
is that relentless positivity or her openness to trying different things.
Or maybe the way she used language so deliberately. It makes you think, doesn't it? How might these ideas apply to challenges in our own lives?
And her spiritual journey, the prayer of Jabez, that deeper connection, it's an invitation maybe to consider what practices might foster our own sense of inner peace or intention.
Could be more important than we realize sometimes.
Absolutely. And really this deep dive is just scratching the surface. Her story opens up so many avenues, mind-body science, complementary therapies.
Loads to potentially explore further if something sparked your interest.
Exactly. So maybe the question to leave with is, what has Sue's journey made you curious about regarding your own well-being and the power you might hold within?